I'll be talking about antisocial personality disorder in this presentation. I have all the citations listed at the end, so if you want to look at the information there, you're more than welcome to. They go in a bit more detail, at least for the Cleveland Clinic, because I didn't take as much information from there because it would have been very repetitive. But if you want to compare and contrast the sources, you are more than welcome to, and I'll have them in the comments section for you to look at as well. The About section that I've listed here. Antisocial personality disorder, sometimes called sociopathy, is a mental health condition in which a person consistently shows no regard for right and wrong and ignores the rights and feelings of others. People with antisocial personality disorder tend to purposely make others angry or upset and manipulate or treat others harshly or cruel indifference. They lack remorse and do not regret their behavior. People with antisocial personality disorder often violate the law, becoming criminals. They may lie, behave violently or impulsively, and have problems with drug and alcohol use. They have difficulty consistently meeting responsibilities related to family, work, or school. Some of the symptoms would be ignoring right from wrong, telling lies that take advantage of others, not being sensitive to or respectful of others, using charm or wit to manipulate others for personal gain or pleasure, having a sense of superiority and being extremely opinionated, having problems with the law including criminal behavior, being hostile, aggressive, violent, or threatening to others, feeling no guilt about harming others, doing dangerous things with no regard for the safety of self or others, being irresponsible and failing to fulfill work or financial responsibilities. On the right, I have a picture that depicts the 10 signs of personality disorders. Obviously, they should reflect what I have listed on the left. I just thought it would add a bit of color, so if you want to find that picture, I also have the citation at the end so you can look at that as well. Here I have more information about the symptoms. Adults with antisocial personality disorder usually show symptoms of conduct disorder before the age of 15. Symptoms of conduct disorder include serious ongoing behavior problems such as aggression toward people and animals, destruction of property, lying and dishonesty, theft, serious violation of rules, and then I have a little bit more information here. Antisocial personality disorder is considered a lifelong condition, but in some people, certain symptoms, particularly destructive and criminal behavior, may decrease over time. It's not clear whether this decrease is a result of the effect aging has on their mind and body, and increased awareness of the impact that antisocial behavior had on their life, or other factors. Some of the causes that I've listed here I'll go into in a minute. On the right, I do have a picture of the antisocial personality disorder symptoms. If you want to look at that, it's also posted by the Cleveland Clinic on the link that I have posted at the end, so you're more than welcome to take a look at that. And if you want to have that image for yourself, you're more than welcome to. Personality is a combination of thoughts, emotions, and behaviors that makes everyone unique. It's the way people view, understand, and relate to the outside world, as well as how they see themselves. Personality forms during childhood. It's likely shaped by inherited genes as well as life situations and experiences. The exact cause of antisocial personality disorder isn't known, but genes may make you vulnerable to developing antisocial personality disorder and life situations. Especially neglect and abuse may trigger its development. Changes in the way the brain functions may have resulted during brain development. Certain factors seem to increase the risk of developing antisocial personality disorder, such as diagnoses of childhood conduct disorder, family history of antisocial personality disorder or other personality disorders or mental health conditions, experiencing abuse or neglect during childhood, unstable or violent family life during childhood. Men are also at a greater risk of having antisocial personality disorder than women are. I have some more risk factors here as well. This is from the Cleveland Clinic. I just decided to add it just to fill it in a bit and give some more explanation. Symptoms of antisocial personality disorder may include physical aggression, hostility, or violence towards others, reckless or impulsive behavior, breaking the law or disregarding rules and social norms, feeling angry, more powerful, or better than others, using wit, flattery, and charm to manipulate, lie, or deceive others for personal gain or enjoyment, not taking responsibility for actions or behaviors, not showing remorse, regret, or concern for those said behaviors. Antisocial personality disorder may look different for each person who experiences it. You might lean more towards certain behaviors than others. If at any point you feel the urge to hurt yourself or others, reach out for help. Contact a healthcare provider or call the Suicide and Crisis Lifeline by dialing or texting 988. This is for US, by the way. Someone is available to talk with you 24 hours a day, 7 days a week. If you or a loved one is in immediate danger, call 911 or your local emergency services number. That little bit at the end is just in case. If you have any sort of issues with these, please contact someone and don't be afraid to. Antisocial personality disorder affects an estimated 1% to 4% of adults in the US. I was actually surprised by this. It seems like, very little, but it is quite a lot of people that it actually affects. But I do have to continue on. Complications. Complications and problems resulting from antisocial personality disorder may include spouse abuse or child abuse or neglect, problems with alcohol or drugs, being in jail or prison, attempting suicide or trying to hurt someone else, having other mental health conditions such as depression or anxiety, financial, educational, or social problems, dying early, usually because of violence. Prevention. There's no sure way to prevent antisocial personality disorder from developing in those at risk, because antisocial behavior is thought to have its roots in childhood. Parents, teachers, and pediatricians may be able to see early warning signs. It may help to try to identify those most at risk, such as children who show signs of conduct disorder, and then offer early intervention. When to see a doctor. People with antisocial personality disorder are not likely to seek help on their own. If you suspect that a friend or family member may have the condition, you might gently suggest that the person seek help from a mental health provider and offer to help them find one. I have some of the citations here, the Mayo Clinic as well, for most of the information that I have listed. These other two that I have on this page are for two of the pictures that I've put in this. You can definitely go take a look at those if you'd like and save them. And then right here I have the one for the Cleveland Clinic. If you want to look at some of the information that I have listed, you're more than welcome to click on these links. I'll also have them in the comments section below, so you can go check them out there instead of having to, type them in yourself. But thank you very much for listening to my presentation. If you have any comments about my presentation or any questions, I'd be more than happy to answer. I'm not sure to what degree the questions will come in, but if you have any, please let me know. Thank you very much.